This recording will go over Chapter 46, Glucocorticoids and Mineralocorticoids. So the adrenal cortex produces two types of steroid hormones, glucocorticoids such as cortisol and mineralocorticoids such as aldosterone. A decrease in steroid secretion is called adrenal hyposecretion or Addison's disease. An increase in steroid secretion is called adrenal hypersecretion or Cushing's syndrome. Because of the influences of steroids on electrolytes and on carbohydrate, protein, and fat metabolism, hypocortisolism can result in serious illness or death. Glucocorticoids are the most potent natural cortisol produced by the body and are influenced by ACTH, which is released from the anterior pituitary gland. Its functions include having an effect on the inflammatory response, metabolism, growth, and biorhythms. Glucocorticoids also affect carbohydrate, protein, and fat metabolism and muscle and blood cell activities. Indication for glucocorticoid therapy include trauma, surgery, inflammation, emotional upsets, and anxiety. Most of the glucocorticoid drugs, frequently called cortisone drugs, are synthetically produced. And as with your prototype glucocorticoid prednisone, you can recognize glucocorticoids or steroids because of the SONE, SON, or SOLON endings that these medications have. Glucocorticoids are used to treat many diseases and health problems, including inflammatory, allergic, and debilitating conditions. Among the inflammatory conditions that may require glucocorticoids are autoimmune disorders, such as multiple sclerosis, rheumatoid arthritis, and myasthenia gravis. So think about how a glucocorticoid or steroid works. It affects inflammation, which is part of the body's immune response. So if the patient has a condition that is an autoimmune disorder, it's a problem because the patient's own immune system is in overdrive, then giving them a drug such as a glucocorticoid that turns down the patient's own immune system and decreases inflammation as a part of that is effective in helping out with those autoimmune disorders. Allergic conditions including asthma, drug reactions, contact dermatitis, and anaphylaxis may be treated with glucocorticoids also. Organ transplant recipients may require glucocorticoids to prevent organ rejection. And steroids, or glucocorticoids, can also be used as part of the drug regimen used to treat cancer. Dexamethasone has been used to treat severe inflammatory responses that result from head trauma or allergic reactions. Your prototype, prednisone, is a frequently prescribed glucocorticoid. Side effects and adverse reactions of glucocorticoids that result from high doses or prolonged use include increased blood glucose, so high blood sugar. Frequently, you'll have a diabetic patient who comes in, let's say, for COPD exacerbation, and they're getting a glucocorticoid to help with their breathing. So even if they're a diabetic who's not on any sort of insulin, sometimes when they're in the hospital and getting a glucocorticoid, it causes their blood sugars to increase. So even though they don't normally use insulin, while in the hospital getting a glucocorticoid, the doctor will order sliding scale insulin coverage. And the patient sometimes gets a little offended because they're proud they don't take insulin, that they're managing their diabetes well. And you as the nurse has to be able to explain to them, oh no, it's because of this glucocorticoid that we're giving you that actually causes an increase of the blood sugar. And as long as you're in here, we're going to have to cover it with insulin. When you're done taking the glucocorticoid, your blood sugar should return to normal. Glucocorticoids can also cause abnormal fat deposits in the face and trunk, so-called moon face and buffalo hump, decrease extremity size, muscle wasting, edema, salt and water retention, hypertension, euphoria, psychosis, thin skin with purpura, increased intraocular pressure, glaucoma, peptic ulcers, and growth retardation. Long-term use of glucocorticoid drugs can cause adrenal atrophy or a loss of adrenal gland function. Because of this, when drug therapy for steroids or glucocorticoids is discontinued, This is important to note. The dose should be tapered, so weaned down or tapered off to allow the adrenal cortex to start producing cortisol and other corticosteroids. Abrupt withdrawal of the drug can result in severe adrenocortical insufficiency. Glucocorticoids increase the potency of drugs taken concurrently, including aspirin and NSAIDs, thus increasing the risk for GI bleeding and ulceration. Use of potassium-wasting diuretics such as furosemide with glucocorticoids increases potassium loss, resulting in hypokalemia. Barbiturates, phenytoin, and rifampin decrease the effect of prednisone because they increase glucocorticoid metabolism. Again, glucocorticoids can increase blood glucose levels, so insulin or oral antidiabetic drug dosage may need to be increased. Mineralocorticoids promote sodium retention and potassium and hydrogen excretion in the renal tubules. The primary mineralocorticoid is aldosterone, which is controlled by the renin-angiotensin-aldosterone system. Mineralocorticoids maintain fluid balance by promoting the reabsorption of sodium, so that the body holds on to sodium from the renal tubes. Sodium attracts water, which results in water retention also. With sodium reabsorption, potassium is lost and hypokalemia can occur. Fludrocortisone is your prototype oral mineralocorticoid. It can be given with a glucocorticoid. Fludrocortisone mimics the actions of endogenous aldosterone. So remember what aldosterone does. It causes the body to hold on to sodium and water and excrete potassium. Because potassium excretion occurs with the use of mineralocorticoids, serum potassium levels should be monitored. Other adverse effects include fluid imbalance, fluid overload, and hypertension. Now looking at your purple nursing process box for glucocorticoids. In terms of assessment, we want to note baseline vitals for future comparison and assess lab results, including electrolytes such as potassium and blood glucose levels. We want to get a patient's weight and also urine output. Corticosteroids can cause fluid retention and weight gain. Assess patient's medical and herbal history. Report if the patient has glaucoma, cataracts, peptic ulcer, psychiatric problems, or diabetes. Glucocorticoids can intensify these health problems. In terms of nursing diagnoses, taking glucocorticoids puts the patient at risk for electrolyte imbalance and also at risk for infection. That's a frequent NCLEX question that you see in terms of steroids or those medications ending in "-sone". So what's the biggest, or what are we concerned about for this patient? And a lot of times it has to do with their increased risk for infection. So just tuck that one in the back of your head and try and remember that one when you go on taking tests. In terms of planning, what do we expect? We expect the patient's inflammatory process to decrease. Steroids are anti-inflammatory drugs. In terms of nursing interventions, we want to determine vital signs. Corticosteroids such as prednisones can increase blood pressure and cause sodium and water retention. Administer corticosteroids only as ordered. Report a weight gain of 5 pounds in 2 days. This could indicate water retention due to sodium reabsorption from hyperaldosteronism. Monitor labs, especially electrolytes, potassium being a big one, and blood glucose. Watch for signs and symptoms of hypokalemia or low potassium, such as nausea, vomiting, muscle weakness, abdominal distension, paralytic ileus, and irregular heart rate. Assess for side effects from corticosteroid drugs when therapy has lasted more than 10 days or the drug is taken in high dosages. Cortisone preparation should not be abruptly stopped because adrenal crises can result. Monitor older adults for signs and symptoms of increased osteoporosis because some corticosteroids promote calcium loss from the bone. In terms of patient teaching, advise patients to take the drugs as prescribed and caution them not to abruptly stop taking the drugs. Corticosteroids are usually tapered off over 1 to 2 weeks. Direct patients not to take cortisone preparations during pregnancy unless necessary. Inform patients that certain herbal laxatives and diuretics may interact with corticosteroid drug therapy and may increase the severity of hypokalemia. Here's one in terms of infection. Teach patient or immunity. Teach patients to avoid large crowds and persons with respiratory infections because corticosteroids can suppress the immune system. Teach patients receiving corticosteroids to inform other healthcare providers of all drugs that they are taking. Teach patients to report signs and symptoms of Cushing syndrome, which include moon face, puffy eyelids, edema of the feet, increased bruising, dizziness, bleeding, or menstrual irregularities. Counsel patients to take cortisone preparations at mealtime or with food to prevent irritation of gastric mucosa. Advise patients to eat foods rich in potassium, such as fresh and dried fruits, vegetables, meats, and nuts. Some corticosteroid preparations promote potassium loss. Recognize that members of various culture groups may need guidance in understanding disease processes. Explain to the family that the patient is not dumb or uninterested, but has an adrenal gland. Explain that symptoms do not go away and may be progressive if prescribed therapy is not followed. In terms of evaluation, we want to monitor the patient for the effectiveness of the therapy. We want to watch for clinical manifestations to improve. Also be monitoring for side effects and making sure the patient has proper knowledge of the drug therapy. Here's some practice questions from chapter 46. Go ahead and pause the video, read them, and then see if you get the correct answers. So for question number 1, the correct answer is C. Glucocorticoids must be tapered off gradually to avoid adrenal crisis. Never stop the drug abruptly. Prednisone is an oral preparation that promotes potassium loss and hypokalemia. For question number 2, the correct answer is D. Side effects of levothyroxine include nervousness, tremors, diarrhea, and insomnia. Remember, levothyroxine is that synthetic thyroid hormone, and so the patient is taking a thyroid hormone, which is going to increase metabolism. So the side effects would go along with increasing metabolism. For number 3, the correct answer is C. I skipped question 4 because it's over material you're not going to be tested over. We're going on to number 5. If you want to pause and answer that question. The correct answer for number 5 is B, methimazole. The correct answer for question 6 is B, levothyroxine sodium.